Welcome back to the Aslan Health Podcast. I'm Dr. Mike Hauman. Today, we begin a three-part series on a common, disruptive, frustrating, embarrassing, and often deeply misunderstood condition: Irritable Bowel Syndrome, Diarrhea Predominant, or IBS-D. If you have ever felt like your gut has a mind of its own, planning your day around bathroom locations, feeling like your gut is hijacking your life, or like stress, meals, travel, meetings, and even simple errands can become a risk-taking bathroom proximity adventure, well, this series is for you. Today, we reveal what IBS-D is, what it is not, the common drivers, why the symptoms are real, and why this condition deserves far more compassion and wisdom than most sufferers receive. Friend, IBS-D is not just in your head. It's not something sufferers can simply get over because someone told them to relax and take it easy. They'll be fine. That's like telling someone with a broken leg to just walk it off. It's probably nothing. So don't just reach for another Imodium and hope for the best. Instead, listen in for compassionate concern and constructive care. As always, this series is for education purposes only. It's not individualized medical care. But my prayer is that it will help you better understand your body, ask better questions, and move towards more comfortable and stable ground with wisdom and hope. Are you with me? Let's go.
Welcome to the Aslan Health Podcast, where science meets soul. Your host for this program is Dr. Mike Hauman, an experienced physician, a certified functional medicine provider, a certified insight coach practitioner, and a devoted follower of Jesus Christ. If you're tired of feeling stressed out, exhausted, overwhelmed, or stuck in survival mode, you're in the right place. So take a deep breath. Let's be transformed by the renewing of our minds. Here's Dr. Mike.
Let's begin today's episode with an analogy. Picture your digestive tract like the roadway on your commute to work. In a routine and healthy state, traffic moves slowly, predictably, and naturally. Not too fast, not too slow. The traffic signals are coordinated and well-timed. Communication is clear, the appropriate signs are in place, and the signals are followed. The roadway's passable, organized, fluid, functional, and effective. In IBS-D, that traffic pattern becomes chaotic and much more difficult to predict. The speed limit gets ignored, the warning lights flash too easily and too often. In IBS-D, the communication signals between the gut and the brain become overactive. And what should be a smooth, natural journey from your gut becomes a frantic rush with lots of road noise, irritability, and random premature emergency exits along the way. I trust that that is a helpful way for you to think about IBS-D. So, how can we define it? Well, as a whole, irritable bowel syndrome is best understood as a disorder of the gut-brain interaction. It means this condition is not simply about stool, and it's not simply about stress. It involves communication between the digestive tract, the nervous system, the brain, the immune system, and the microbiome as well. It's like the malfunctioning signals on our roadway analogy. IBS-D specifically means the predominant bowel pattern is loose, urgent, or frequent stools, oftentimes along with abdominal pain and cramping related to changes in stool form and stool frequency. The pain may improve after a bowel movement, but it may not fully disappear. Sufferers also deal with bloating, gas, urgency, and cramping along the way. Many live with a low-grade persistent gastrointestinal uneasiness. Others have occasional difficult flare days. Still others live with a strange combination of, I look fine on the outside, but my internal life feels like an emergency. This is one of the reasons that IBS-D can be so challenging, unsettling, and sometimes lonely, because the sufferers can appear outwardly normal while living in a body that feels unpredictable, uncomfortable, and urgently volatile at times. So, if you or someone you care about suffers from this condition, let's provide the truth and a dose of hope. Friend, your symptoms are not imaginary. Now, that does not mean that nothing is wrong. It simply means that the problem is typically functional rather than structural. In other words, many people with IBS will not show visible ulceration, bleeding, or identifiable tissue pathology on routine testing, the way that someone with Crohn's disease or ulcerative colitis might. But the absence of visible damage is not the same thing as the absence of suffering. Your gut can be deeply functionally dysregulated without being visibly structurally damaged. Going back to our analogy, the roadway itself may be structurally fine, however, the function is disordered and chaotic because of the signaling. That distinction is important. If your doctor or your endoscopy exam did not find anything structurally wrong, that does not mean that your symptoms and struggles are fictitious. The pain of IBS-D is real. The urgency, the bloating, and the life disruption, they're all real. So let's reveal the deal, and why does IBS-D happen to begin with? The real answer here is that there is no single cause, and that's part of why it makes it frustrating and difficult for individuals to manage. IBS-D is often multifactorial. For some people, the gut moves too fast. For some, the intestinal nervous system becomes hypersensitive, so gas distension feels uncomfortable or painful. For some, the microbiome, think gut inhabitants, has shifted to less favorable resident populations. That's the wrong organisms in the wrong amount or wrong location in the gastrointestinal tract. For some, it begins after a significant gastrointestinal infection, like food poisoning, a travel illness, a stomach bug that ran its course, but the gut never really returned to baseline normal. For some, stress is a major amplifier, not because stress causes everything, but because the brain and the gut are in constant conversation. So when your brain perceives danger, your gut often changes its behavior to match that perceived state. This means gut motility, sensitivity, secretions, and pain signaling can all change, just like construction, accidents, and light malfunctions affect traffic patterns. This is one reason why many people notice that gut symptoms worsen before a stressful meeting, an interpersonal conflict, challenging travel, or in seasons of loss, anxiety, overwork, or exhaustion. Again, that does not mean that IBS-D is purely psychological. It means that your gut-brain connection is powerful. And remember, friend, God designed that system, and your body is doing its best to communicate with you about your internal state. The next logical question, how then is IBS-D diagnosed? It's not by a single simple magic lab test, which is actually the case for most functional gastrointestinal disorders. It's diagnosed by a pattern. That pattern includes the symptoms we mentioned earlier with recurring abdominal pain along with changes in stool frequency or stool form. And a wise clinician also thinks carefully about what must be ruled out. That is where many sufferers get stuck. Some have too much testing, others not enough. Some are told, everything looks normal, and then they're dismissed, while others are frightened into believing that every episode of diarrhea means cancer, colitis, or catastrophe. Neither extreme is helpful here. A wise medical approach asks the question, does this fit IBS-D, and are there any factors that point elsewhere? That's why in a diarrhea predominant case, clinicians often think about things like Crohn's disease or celiac disease, inflammatory bowel disease, infectious causes, bile acid diarrhea, and other assorted causes of chronic bowel issues. And there are also alarm features that deserve real attention. That's blood in the stool, unintentional weight loss, fever, anemia, symptoms that may wake you from sleep, a family history of colon cancer, inflammatory bowel disease, or celiac disease, or even the new onset of major bowel changes that do not fit your usual pattern. So, IBS itself deserves compassion, yes, but warning signs deserve a professional evaluation and workup. That's one reason I want to say something kind but direct to the listener who is suffering with this. Please do not rely on self-diagnosis alone of IBS-D without a thoughtful medical evaluation. Yes, many people do have IBS-D and nothing more, but "I've had diarrhea and cramps for a long time" is not enough to stop asking whether there's more to your story. Friend, wisdom does not panic, but neither does it ignore the symptoms and just hope for the best. So, what does IBS-D feel like in real life? It often feels like living with a reduced margin for error, constantly aware of your surroundings, scanning for the symptoms of your next attack. You think about exit proximity on the highway, you search for bathrooms everywhere you go, you hesitate before eating something new or different, you become suspicious of restaurants, road trips, coffee, dairy, airplane travel, outdoor weddings, and any situation where your dignity and intestinal urgency might collide. And unfortunately, the emotional burden of all of it becomes associated with the condition as well, all woven together in uncertainty, hypervigilance, fear, frustration, and sometimes embarrassment. I do not want you to continue with this issue and its associated struggles when there are effective ways to address the root causes driving your symptoms. I know it may seem challenging, random at times, and chronic in nature, but friend, there is hope. I'm reminded of Psalm 139:14, which says, "I praise you, for I am fearfully and wonderfully made. Wonderful are your works. My soul knows it very well." Friend, if your gut is disordered, that does not mean that you are defective. If your bowel pattern is chaotic, it does not mean that God has forgotten you. He made you wonderfully well. Your struggle does not define your worth. So if you have spent months or even years organizing your life around flare prevention, that does not define you. It may mean that you're living in a body that needs directed attention and a different care plan than you currently have. I've learned that when it comes to IBS-D, it's not always clear to the sufferer just what exactly ignites the explosion. So, I want to reveal one more thing today. That is, not all triggers are equal. I know people love simple explanations like, "Oh, it's just gluten," or "It's just dairy, just stress, it's just your microbiome, it's just anxiety." Those issues may all make a great hook for a social media post, but they are disingenuous and physiologically false. Typically, it's not just one thing. A properly functioning body is a divinely and perfectly orchestrated marvel. All parts and systems work together synergistically to balance your health and well-being. That is why a wise, effective plan must be thoughtful, thorough, and intentional. Not random, trendy, or desperate. And certainly not solely dependent on the newest probiotic advertised by an internet influencer with zero clinical experience. So, what should you do after today's episode if you have irritable bowel syndrome with diarrhea? My advice? Download the document attached to today's show notes for helpful details. As always, it is intended to be helpful, practical, and easy for you to implement. Or, if you prefer, subscribe to the free Aslan Health newsletter for more detail. It's easy access to those resources downloadable from the newsletter itself each week. Your first step? Start observing. No judgment, no diagnosis of doom, no obsessive self-surveillance. Just begin noticing your patterns. This week, track several things. Use the log included here. Your abdominal discomfort level, your stool frequency, your stool form, your urgency, what you ate and how it affected you, your caffeine intake related to your symptoms, your stress level, and whether your symptoms were better, worse, or unchanged after a bowel movement. I recommend keeping a simple log, which I created and included in the downloadable document I just mentioned to make it convenient for you. You don't need to do this forever, just long enough to reveal what your body may be trying to tell you. Because I believe that we must reveal what's happening in your body before we seek to reset and renew your health. Before you change your plan, you need to understand your pattern. And before you chase down a solution to a suspected problem, you need to call your gut symptom by the correct name and target your care towards the real underlying reasons why your body's behaving the way that it is in the first place. Because your body is not your enemy. Your gut may be distressed, it may be overactive, it may be sending signals too loudly and moving too fast. But that does not mean that it's beyond help or that it's rebelling against you. It is simply trying to get your attention and the help that it needs to function well again. In our next episode, Reset, we will discuss what to stop doing when your gut's on edge and what to start doing instead, how to approach food without fear, and how to calm both your bowel and your nervous system in practical ways. I'll also provide my favorite suggestions and tips for managing irritable bowel symptoms. Thank you again for joining me today on the Aslan Health Podcast. I'm Dr. Mike Hauman. Please check the show notes for more details and then subscribe and follow me for more. Until next time, may the Lord grant you wisdom and increasing peace as you rest and trust in Him, even in the places that have felt chaotic for so very long. Blessings to you, my friend, until we're together again.